In August, at just 3 months old, Baker Mills entered an Atlanta Children's Hospital with COVID-19.
One of our biggest fears when we were pregnant with him was knowing how bad COVID was him getting COVID because of all the unknowns about it and not knowing what to expect and hearing all the stories on how bad people with COVID is and how people are dying.
Although Baker had relatively mild symptoms, doctors still decided to hospitalize him due to his young age.
I'm just glad that it's not as bad with him, and I think it has a lot to do with us being fully vaccinated and me getting vaccinated while I was pregnant with him.
As of mid-January, about 8.5 million U.S. children had tested positive for the coronavirus. About 11% of those cases were confirmed during a 2-week period in January of 2022. While children generally have milder symptoms, the speed at which Omicron spreads is overstraining the system.
This Omicron wave has really been, we have matched our worst Delta wave with hospitalizations, and then even more than that are clinic visits for what might be considered mild cases, but it's overwhelming clinics and emergency departments with just the number of kids coming in with fevers and real sore throats, and it's just a large volume of visits.
Children under 5 remain one of the most vulnerable groups because vaccines have yet to be approved for this youngest age group. As a result, many parents are opting to not send their little ones to daycare and pre-K. Yelena Wheeler, mother of 5-year-old CJ and 8-year-old Cambria, is among them.
And now the school districts are like, we don't have funds. We're not going to do mandatory testing. And so come send your child. We can't guarantee it's safe. I mean, we understand nothing is guaranteed safe, but it's one thing if all other districts were not doing mandatory testing, but one of our biggest districts right next door to us, 3 blocks away from here, LAUSD, has mandatory testing, and we don't.
But for other parents, COVID is now a part of life, and there is not much that can be done to avoid it altogether.
I'm not worried about it all. I want them to be open. I want my kid to go to school. In fact, I think schools, now that vaccines are widely available, the officials should start thinking about making school normal again.
In early January, U.S. Secretary of Education Miguel Cardona encouraged schools in the country to remain open for in-person learning. Many authorities recognize that online education has been hard on both children and parents, and that every school district is different.
I don't think that this is the time to have any one-size-fits-all on this. I think communities are seeing this classroom by classroom and school by school, how they need to continue to adjust to keep things reopened.
By mid-January, 64% of teenagers aged 12 to 17 in the U.S. were fully vaccinated, according to the CDC. Authorities are encouraging parents of younger children to vaccinate their younger kids aged 5 to 12, as doctors are preparing to deal with the rising surge in younger patients. For Mariia Prus in Washington, NRI's VOA News.